Welcome to training. My name is Tara. Today you're here to learn about the SHA patient booking system. To help you understand why you are here today and to set the stage for training, we are going to run through a few slides. Our outline for training today, we are going to go through the goals of the immunization campaign. We are going to look at the SHA patient booking system overview, and then we will get into the training. The immunization campaign goals are to protect those most vulnerable, minimize serious illness and death, protect healthcare capacity, and minimize the spread of COVID-19, immunizing as many people as quickly as possible. The goals of the SHA patient booking system are that it's simple, fast, and easy to use. Reduces delays noted by patients and providers when using paper-based booking processes. It is open to all citizens, including those living in border communities and those without Saskatchewan health cards, like new immigrants. There will be no long lineups, providing safe patient flow through the pandemic response, ensuring patients are spread out in a safe manner to receive their immunization. The online tool for most citizens, coupled with a telephone option for those requiring more assistance. In the future, the booking system will be used to meet the needs of many SHA services, including COVID-19 testing, lab services, and mental health and addictions. The online option only takes a few minutes. It's initially going to open to a small age group. This will ensure a positive experience for everyone and better align demand with vaccine capacity. All appointments available will be shown in the booking system. The booking office will not have access to more appointments than what the patients can see. You can cancel or edit your appointments in the same place. Family members and health providers can help other people book in, and it's accessed directly from the Saskatchewan.ca COVID-19 vaccine site, and it is both desktop and mobile friendly. The SHA patient booking system is one system, but it does have multiple interfaces. There is the public interface where citizens will go online to book their appointments. There's an expanded version of that website that the booking office will use to book patients into the system that need some additional assistance. And then we have the demographic master or the clinic master, which clinics will use to check in and out the patients as they flow through the clinic. There are a number of tools to help you support your workflow and insights. We have the SHA patient booking system, which is where, of course, patients are going to be booked. It will have your scheduling, your check-in, check-out, and your screening. You'll have access to the Panorama Quick Entry form for recording doses and reviewing previous doses. You have other resources like email, your local electronic medical records, and multifunction printers, as well as the shared client index for demographic lookup and looking up health card information. Now we're going to begin with the training. So the application we are using is called QFlow. As I mentioned during the PowerPoint, QFlow does have multiple interfaces, but ultimately is one system. The public interface is where citizens will book their appointments and feeds into the back end of the system. Clinics will be using QFlow to manage patient appointments and the flow through the vaccination clinics. And an expanded version of the public interface has been developed to allow the provincial vaccine booking office and clinics to book appointments for patients who cannot book on the public interface due to age, having no HSN, having no email or cell phone, being considered clinically extremely vulnerable, or an employee. You will be required to enter your QFlow username in order to override these requirements, which you will see as we go through the training. Your manager would have submitted a request for your access, so a login could be created for you. You will be receiving an email with your username and password along with the links to the web-based interfaces, the support line information, as well as the link to the training information available for you. I'm going to go to that training information right now. So on our patient booking systems training materials SharePoint site, we do have our training event and access requests. You have a section for training materials, including our user manual. It will have a document that shows any of the latest updates. We also have the quick reference contact information for the digital health support team for the patient booking system. And you do have a quick reference for the service console navigation, which is going to be a big part of your everyday job, managing patients as they flow through the clinic. If you're needing any reports, there are work standards on here for reports, and I will show you during the training where you can find those. We also have additional video for you. So you're here to learn your vaccine clinic functionality. There is also a training video on here for online booking and the QFlow patient demographics. We will not be covering that portion of the training today. If that is something that you will be doing at clinic level, we would ask that you go ahead and come to another training session or watch the online booking and QFlow patient demographics video. It does require a password. The password is just right here at the end for you. Okay. So when you get your login information, you will have the link to QFlow. And I'm just going to start by logging out just so I can show you exactly what you'll see when you get the link. So when you receive your link, it's going to ask you to go ahead and log in. Okay. Now, the first thing I recommend you do when you log into the application is change your password. And I will show you in just a second where you can find that change your password functionality. Okay, I'm going to click cancel there. But a couple things about your password. When you are resetting your password, it needs to be 8 characters with 2 special characters. What we typically recommend is to pick a secure word that only you will remember, and then you can always change the A's to the @ symbol, the S's to the $sign, or I's or L's to the exclamation point, so that you have a secure password, but something that you will remember. After 3 failed attempts to log in, the system will lock your account and you will need to call into the digital health support for the patient booking system to have the account unlocked. And they can also reset the password for you. Please do not call into the eHealth service desk or your IT. They will not be able to help you with this. You need to call into the digital health support for the patient booking system. Okay. And remember, you are dealing with patient information, which falls under the Health Information Protection Act or the HIPAA legislation. So please keep your login information secure. Do not look up information unless it is needed to do your job. And you cannot look up your friends and family's information. So we're going to begin with some basic navigation of the QFlow application. At the very top, we have our Start button. Within there, you can search for information as well as functionality within the program. So as I said, when you first log in, you should change your password. If you can't remember where I'm going to show you to find it, you can always come into the search and type password, and it takes you right to your change password. So when I click on that, it's like any other website. You enter your old password, your new password, confirm the new password, and click save. Really easy to do, okay? And we do recommend to change your password every 3 to 4 months. Okay, I'm gonna go ahead and click cancel. The next panel we have is your user panel. So up at the very top, you will see when you log in as yourself, of course, your username. It will have the group, which is the permissions that your account has. It will have the top unit. Everybody right now has the SHA as their top unit. That's going to assist you. So if you are working in multiple clinics, you do not have to call in with every new clinic you're going to be working at. You will be able to just navigate to that clinic's information. Now, the current unit, I have it currently set to SHA, and I'm going to leave that for a minute, and we'll come back and I'll explain this. Okay. This information is for clinic use only and will need to be updated in order to access your service console. Okay, so we will come back to that. Down below that, you're going to see the link to change password. So this is another place where you can find your change password. Okay, and it's exactly the same as what I showed you. And then you also have the link to sign out. It is very important that you sign out of this application correctly. It is a two-step sign out process. So you'd click on sign out, and then you need to click on sign out again in order to complete the sign out process. If you don't, the system is going to appear as if you are still logged in and able to help patients. So as I mentioned, it is vital that you use the sign out properly. Okay, I'm going to click cancel because of course we're not quite done with training yet. And I will point out there is another way to sign out, and that is through this icon in the top right-hand side. It's the door with the arrow. Okay, that will also sign you out. It is the same two-step process. Do not use the X in the top right-hand corner. That does not sign you out of the application. Okay. We have our tools panel, which within there you will find your service console, the calendar, patient search, case search, and again, a link to change password. We'll be reviewing these during training today. And this change password is the exact same as the one that's in the user panel. Okay, there's no difference between them. You can use either or. Okay. You have management, info center, which is where you can find your reports. And again, the work standards for running the reports are on the training website. And then last but not least, we have favorites. So you can actually add any current page to your favorites. Okay, so if you know which sections of the application you're going to be using and you find it inconvenient to come into the panels, you can add a tile shortcut to your home screen so that you can quickly navigate. So for example, patient search is probably something you'll be using quite a bit. So if I go to my patient search, I can click on favorites and add current page. Okay, now when I look at my home screen, you will see a tile appears for patient search. If you've added a bunch of tiles and then you realize, you know what, I'm never going into that one or very rarely, and you want to remove it, you just click on favorites and then click on the X beside the page and it will remove it from your home screen. Okay. So to begin the training today, I'm going to actually show you the patient search. So we're going to go back in there to Tools, Patient Search. You have the ability to search by patient ID. So you need their personal ID number and then their ID type. If you're unsure of what their ID number is, rather than having to click between the different ID types to try and find it, sometimes it's going to be easier to search using free text. You can use the patient's name, you can use their phone number, you can use email. You can use any of those. The only thing you want to watch when you're searching by text, of course, is that you have enough information so that you're not getting pages of results, but you also don't want to put so much information that you may end up not seeing what you're looking for. Okay, so if I have a patient in here and I happen to know his name is Casper, I'm going to go ahead and search Casper. And the system is just being a little slow today, so we'll give it a second. There we go. So we've got Casper Ghost. Okay, I think it's supposed to be Casper Ghost. Somebody misspelled his name. So we want to go ahead and fix that. So I'm going to click on the personal ID to bring forward his information. So on the details tab, I have his personal ID, I have his health number, and of course the first name, last name. So I'm going to fix the spelling of the last name and put it correctly as Ghost. Okay, so if you have a patient that comes in for their appointment and they maybe booked it themselves, or maybe the booking office spelled it incorrectly when they booked it, you want to make sure that the information here does match their health card. Okay. And then if we keep scrolling down, that's probably about the only thing I need to change on this record. So I am going to go ahead and click on the save on the far right-hand side. Okay. Now, if Casper was looking for, or if I was looking for appointment information for Casper, then we do have the cases tab within the patient search. You can click on that. The first thing I would do with that is change your filter. If for whatever reason it defaults to last week, I would recommend to change it to all. Okay. And then you are seeing all of their appointment information. So we can see that there was 2 appointments for Casper. He had one originally in Moose Jaw. And this one, if we look and hover over top of the little folder there, shows me that it's a little gray happy face and it says close. Okay. And then we have this one, which is red, that says active. If you'd like more information on the appointment, you can click on the date and time and it will link you to the appointment details. Okay. So with this one, we can see that Casper Ghost had an appointment for March 12th at 9 a.m. and it was canceled. If I need additional information about why that was done or who did it, I can expand the steps history section below, and it will give you the who booked it and then who canceled it. Okay. And that was me. So it was actually booked online and then it was canceled through the online as well. Okay. All right. I am going to go ahead and look at next. We are going to look at the case information. So I'm going to, you can click back on home if you want to go back to your home screen, but you don't have to. You can just hover over top of tools and go directly to the case search. So case search is another way to get to exactly the screen we are on right now. Okay. So it's just another method of getting there. It depends on what you're doing. So when you're looking at the case search, there are some options for you to search by. You can search by the case number. So I happen to copy Casper, so I can just put that case number directly in here and I can click on search and it would find him, or it would find that case, sorry. If you aren't sure which case and you just want to see what cases they all have, you'd want to put in their ID number in here instead. Okay. And then you do also have the option to search by a queue number. The queue number is a ticket number that is assigned to them when they check in for their appointment. And I will show you and explain that more once we get to the service console. Okay. So if I put that case number back in here and I click on search, as you can see, it takes me to the search results. I can click on the case ID and it brings us exactly to that case. Okay. All right. The next thing we're going to go look at is our calendar. So again, I don't have to click on home, but you can use the path link if you want to go back to the home screen. Okay. And you can go to tools and into calendar. Okay. The system is bringing me to the last calendar I happen to be on. So up at the top here, it's in the link as well as in the calendar header. It gives me which calendar I'm looking at, and it gives me the date. On the right-hand side, I can, of course, pick a different date using the calendar. Any of these days in the dark blue are clinic days. There is a schedule built. This is our training clinic that we use for training. We have training every day, which is why every day is blue. But typically you will see white days in here that you won't be able to click on. And I'll show you another calendar so you can see that. Okay. Now, if we need to navigate to another calendar, you use the resources section below. So there are my calendars and my resources. We actually do not have resources built in right now, so you can minimize that section. So in the My Calendars section, you would look for the grouped by unit. So I'm going to go ahead and click on the plus sign to expand that. And because, again, remember, I am at the top SHA level, I start at SHA and I would just narrow down my results to find the clinic I'm looking for. Now, they are set to the different areas and the different regions, and within each of those is the networks. So if you're not sure what network you belong to, but you know what clinic you're at, you can click that in the search above. So if I was looking for, let's say, Ituna, I would just type that in and I can click on the search, or I can just press enter on the keyboard and it will narrow it right down to Ituna for me so that I can click on that calendar. And here's a good example of a typical calendar. It has 3 days this month. So any of these days in blue are calendar days. Okay. So once you find the calendar you're looking for, if this is the only clinic you're going to be working in, you can click on this blue star and it will add it to your favorites. Okay. And that shows up in the My Favorites link. All right. So when we are looking at the clinic, the one thing you may want to look at is the monthly view. At a glance, oh, sorry, the system timed me out. Give me one moment to log back in. Okay. And notice it took me right to Ituna's calendar this time because that was the one I was on last. Okay, so if I click on the 17th again, so I'm on the correct day, I'm going to click on the monthly view and I'll just show you that the monthly view is kind of nice because it does show you the vacancy percentage on any given day. So you'll know which days are clinic days because they're in blue, and then it will tell you which are not. It just says no calendar. Okay, so that's what those mean. All right. So I'm going to go ahead and navigate back to my training clinic. And again, we have schedules every day, so it's a little unrealistic, but we need that for training purposes. So I'm going to go ahead and navigate back to my day view now. Okay. Now with my day view, you can see for the 17th, for example, I have 6 streams. Okay. Sometimes people call them swim lanes. Basically, what that means is that on this day, we are going to have 6 immunization stations running at the same time. Okay, so let me navigate back to today because I do have some appointments for today and you can see that. So today I only have 5 immunization stations running. Okay, so that can be adjusted depending on your clinic need and the clinic schedule. Some clinics will have maybe only 1 person in the morning, 2 people in the afternoon, and maybe 3 in the evenings. So every clinic is going to be just a little bit different. Okay. Up at the top, we do have some icons that can help you navigate the calendar. So the first one, today. Then you have your standard previous and next, which will take you backwards or forwards a day at a time. You do have this new icon, but it is imperative, as I stated, all appointments are to be booked through the front-facing interface and not through the back end of the system. They will be performing quality checks to ensure that no one is using this function. So again, I do caution you, do not use this to book appointments. The front-facing interface has all of the rules needed to ensure patient safety, and required information is included with the bookings. Okay. Day view is what I'm on right now. Week view, I think, is pretty standard. And then I already showed you the monthly view. Down below that, we have different filter options for our calendar. So right now I am on our day view. You'll notice on the top, I do have it set to a ×3. The reason I have that is because when you first log in, yours is going to default to ×1. You do get to see more of your day at a time. However, you lose the appointment information. If you scroll down to the very bottom, there is a legend that tells you what each of the colors on the calendar mean. So I know blue is vacant and green means booked. So any of these green ones I know are booked. And if I hover over top, it will show me the information for the patient. However, it's not very convenient. So I like the ×3 view, then I can actually see my patient information. Okay. The other option for you for your view is the list view. So with our list view, it shows you all the appointments that are booked today. If they've already gone through clinic, you'll be able to see that through the different icons. And if you hover over top, it gives you a description of what all of that means. We'll talk about those once we get into the service console. Okay. You have the other filters remaining, next hour, waiting, and canceled. Those are pretty self-explanatory. The last one we have is direct admit. Now, this is not how we actually do direct admit patients. That is always done through the service console. This direct admit is just a filter that would show you who has been direct admitted today or whichever day you're on. Okay. All right. So that is our calendar navigation. So now we're going to, oh, sorry, actually it's not. There's one more thing I forgot to show you, and that is the print calendar. So with our print calendar, that is the icon on the top right-hand side here. If I click on print calendar, it brings me up a selection of what I'm looking to print. Now, we do caution when printing calendars because remember that it is an electronic program, so as soon as you print the calendar, it is basically out of date because you could have 3 people booking online right now as we're printing the calendar that will not show up on this printout, okay? Or you may have people canceling, that type of thing, all right? The other reason I caution against printing the calendar is that it is personal health information. So you do need to keep this information secure. You can't just leave it lying around, okay? But you can pick what you show. So there is the option to have their personal ID, their first name, last name, phone number. You can pick what you want to see and then click on the print on the far right-hand side. And it opens up a new tab in your browser, okay? So because it is just a website or a tab in the browser, I mean, then there is no print button, but you can click on your menu for your browser and click on print, or you can simply right click on the page and click print. Okay. I'm going to close that tab and go back to my QFlow. I'm going to click back so that I'm back on the calendar. And now we will be navigating to this service console. So the service console, depending on your role and how your clinic is going to use the system, some of you may spend the majority of your time in the service console. This is where you will know who is expected, which patients have arrived, which are waiting, and what step in the immunization process they are in. In order to access the correct information for your clinic, we need to change the settings in the user panel. So the reason I left it on SHA to begin with was so that we could access all of the calendars. Okay, so the first time you log in, I would go and I would mark the calendars that you're going to be using as a favorite first. If it's just the one clinic, you won't have to worry about that. But if you are going to be working in multiple clinics, it might be easier for you. Now, once you have that set up, now when we go to Service Console, we need to go to the clinic itself. So the current unit is the clinic. So when I click on the drop down, it's going to start me at the SHA level. And then you just need to go down to the area that you're looking for. Okay. So if I'm looking for Moose Jaw, for example, I'm going to expand Southwest and Southwest 3, and there's the Moose Jaw exhibition grounds. Okay, so I just pick the correct one and it would give me that clinic's information. Now, if I just pick Southwest, you'll notice there is no option in location and there is no option in function. That means you're at a top level, not a clinic itself, and it will not work. You have to pick the clinic itself. So for, of course, training, I'm going to use my training clinic. So current unit is the clinic. Location is where are you working within that clinic. We have built 2 options in there for you so that you kind of can get an understanding of what these do. So we have 2. I'm going to go ahead and start with reception. Okay. Then our function. We only set 1 for right now, just until people are familiar with the application. That could be expanded on later. But for now, you do need a function and you do need a location for the service console to work. So I'm going to go ahead and click update. That way, every time I log in, it will take me to that information and I don't have to set it every time. Okay. All right. So now we can navigate to the service console. So when you come to the service console, you should see patient information on here. Okay. Now within the service console on the far right, you're going to see that here it says reception. So the location can be changed right within the service console. So can the function, even though we only have one right now. So that if they do expand on this later on, you can set your location and function right from within the service console. The difference being, if I change it in here, it doesn't actually save that. Only if you do it through the user console and click update will that save that change. We also have a find cases search box in here as well. Now this is different than the case search that we did here. So when we did this case search, I was talking about that queue number, and I said that's something that the patient gets assigned to them when they check in or when they arrive at the clinic. So when we're looking at the service console, our Casper Ghost here has a ticket number. That is that queue number. Okay, queue number, ticket number, it's the same thing. Okay, so that V500 is what I would put into this find cases if I couldn't see that one right from here. Okay. On the far left-hand side, you have the next button. What that does is if you have a case assigned to you that you're working on and the patient is done at the clinic, you would click on next, it would close that case and automatically assign you the next person. Okay, and I am stressing that for a reason. So it has to be that the patient is done at the clinic, not that you're done with them. Okay, there's other options if they're staying within the clinic. Okay, and I'll show you that as we go through. Close is the same idea. It will close a case that you are currently working on when the patient is done at the clinic. Okay. The difference between the two is close will always just bring you back to the case list, and then you can manually assign the next person to you when you're ready. Next will do it automatically. Okay. Below that, it'll have your username and it will have your status. Now mine, as you can see here, says idle. Now, obviously that doesn't mean I'm idle in the application because I've been in it the whole time. What it means is that I'm just not currently serving a patient. Okay. On the far right-hand side, you're going to see the calendar link. So you can quickly switch between the service console and the calendar. Okay. Below that, we have 3 different tabs. You have your case list, which will show you the appointments that are coming based on the filters you set in these drop downs, which I'll talk about in a minute. You also have a My Cases tab, which will show you any cases currently assigned to you. And then you also have the Back Office tab, which only displays when you are in idle status. And it's something clinics may use in the future. It's not being used right now, but it's used to track administrative tasks. So that if maybe you're stocking supplies in between patients, you can put that in there so that they know why you weren't seeing patients. Okay. I'm going to go ahead and click back on case list. Okay. Now, before I go into those drop downs, I want to talk about the services first because it'll make more sense. So the reason this is called a service console is because we are managing services. A service is a touch point for the patient as they go through the clinic. So our first touch point is the training clinic calendar. Okay, it's not the same calendar as this. What it is it's taking that calendar service or taking the information from the calendar using the calendar service and feeding it into the service console so that you know who's expected today. Okay. The next service we have is the screened and checked in. This is going to be the second touch point for the patient. And as the title describes, the patient has passed through the clinic or the facility screening and is now checked in and ready to be immunized. The last service or touch point for the patient is the clear to go and check out, which is where they will go for their 15-minute recovery time after they have been immunized. Okay. In the future, I'm sure they will add more services. It's just right now we wanted to give you just a great introduction on how the functionality works. Okay. So let's go ahead and look at these drop downs now that you have an understanding of what the services are. You have your view, which is either single service or group by service. Depending on how large your clinic is and depending on what you're going to be doing in the clinic, you may want to look at just a single service instead. So if I'm an immunizer, I'm not worried about the calendar. I'm worried about who's screened and checked in, who is ready to be immunized. Okay. Whereas if I'm reception, I am worried about the calendar. I want to know who's coming in today. Okay. And then the filter drop down will filter out the appointments you're seeing based on the status of the appointment. So for these ones, they are all in expected status, and I'll explain in a second how I know that. But if I change my filter to, let's say, active, they're all going to disappear because none of them were active. Okay, same with waiting. Waiting and active are kind of the same thing in this system. So neither of those are showing any results. So let's keep going. You also have the served by me. So anytime you assign a case to you, it will actually show up in your served by me, even if you weren't the one that closed the case. Okay. The waiting and expected is typically what I leave mine on so that I see all of the appointment information. Okay. And I do, for training, prefer the grouped by service so I can show you how somebody will flow through the clinic. Okay. Now, the reason I knew that these people were all expected and not here is because when I hover over top of this happy face, it tells me that they're expected. Okay. So the black happy face is when they are expected. The blue happy face is when they're waiting. Then you have the time. So this will be the time the appointment was booked for. The next number will be the ticket number, which will get assigned to them when they arrive. And then you have the patient's name. On the far right-hand side, you have a view. This allows you to view the patient information without actually assigning the case to you. Above that, you have the next in service. Next in service will automatically call the person that's been waiting the longest and assign it to you. And then direct admit will come back to in a minute. Okay. And then on the far right-hand side, you can see services in the current unit. It shows you all three services. It shows you how many people are waiting in each service, and then it will show you the longest wait time. So our one poor Casper ghost has been waiting in the screened and checked in for 1 hour and 50 minutes. Probably want to get him immunized right away. Okay. Which we're going to look at right now. All right. So I'm going to say that Austin Martin has shown up for their appointment. Okay. So when we are marking somebody arrived, the system refers to that as NQing. Okay. And there's the easiest way to do that is to just left click over top of the appointment and click on NQ. And you'll see they've now changed from the black to the blue. So now we know that they're waiting. Okay, I'm going to say that Toyota showed up for their appointment as well. So I'm going to NQ them. And I'm also going to NQ Triton here. All right. So all three of these people have arrived, okay? And you can tell by the ticket numbers who arrived first, but you can just use the next in service and it will automatically call up the person who's been waiting the longest. Okay, so I'm going to go ahead and click next in service and it's going to bring up Austin Martin. So Austin comes up to the reception desk. I go through the facility screening with Austin and they pass the facility screening. So I'm going to route them to the screened and checked in so that they can be immunized. Before I do that though, I just want to run through some of the other options for you. You do have the option to return them to the queue. So if maybe the phone rings and you have to take it, or somebody comes up and you have to deal with that, you can return them to the queue and then just recall them when you're ready. You do have the option to mark them as absent. A lot of clinics will be doing this at the end of the day. Anybody that didn't come in that day would be marked as absent. And that needs to be done so that the patient can go online and book their appointment, because they can only have one first appointment. Okay, so if you leave it and the system will just not let them book. Okay, there is the hold option. Now, with the hold option, be cautious with that because whoever puts the patient on hold is the only one that can remove them from the hold. So if I put them on hold and then I leave for the day because it's the end of my shift, nobody else is going to be able to work with that appointment. Okay. And then, as I said, what we're going to do is we're going to route them to the screened and checked in so that they can be immunized. Okay. So now I'm going to switch hats. I am now done working at reception and now I'm going to do the immunizations. Okay. So I'm going to change my location to position 1. Okay. And I'm going to use the next in service to automatically call up the person that's been waiting the longest, which is Casper. Okay, so Casper comes up and I do my vaccination screening with them and I get their consent. Okay, so Casper's given me his consent. He passes the vaccination screening. Now I need to document this. Okay, documentation is very important and they have made it as easy as possible for you. So if you click on the plus sign beside document and classify and scroll down to the classification section, as I mentioned, Casper has been immunized. All I have to do is click the checkbox beside immunized. There's no numbers to remember, no codes to remember. You just need to click off the checkbox. They are going to be looking for numbers out of this system. So every person going through the clinic needs to have that documentation complete. Okay. So we mark them as immunized, and then I'm going to scroll back up to the top. Oh, and I should point out here, you also do have the ability to add in any interaction notes. If something happened during the visit that you want to track, you can put that in the interaction notes. With that one, when you enter something in here, the save will activate and you just click on save. Okay, I'm going to leave that blank. This one was fine. No interactions noted. So now I am good to go ahead and route him to the clear to go and check out. So now he's going to the recovery area where he will wait the 15 minutes and then he will be able to leave. Okay. Now you'll notice the services in current unit hasn't updated yet. Sometimes it does take a minute for that to update with the time. Okay. So we're going to say the 15 minutes is up for Casper. He waited his 15 minutes. Now he's ready to go. He comes up to whoever's manning the recovery area, says, I've waited my 15 minutes. I'm good. No reaction. I'm ready to go. That person will go ahead and use the next in service to assign it to them. If you wanted to check how long they actually were in the clear to go and check out, you can verify that information using the steps history. If you click on the steps history, you can see when they were transferred to the clear to go and check out. And yes, I know it's only been 33 seconds, but we're in training and we don't want to wait 15 minutes. So we're going to pretend. Okay. The other thing you may want to check if you are in that recovery area and monitoring things is you may want to monitor to make sure that the documentation was complete. So to do that, when it's done through the document and classify. But once it's done, it's actually saved in the interactions history. So you want to click on the plus sign beside interactions history. And here we can see immunized. Okay, so we know the documentation was done. Casper is good to go. We're going to go ahead and just close this ticket. Again, close is when they are leaving the clinic. Okay, so I've gone ahead and closed that. All right. The next thing we're going to do is we're going to go ahead and I'm going to go back to my reception station and I'm going to call in Toyota. So I am going to next in service. Okay. So Toyota comes up and we are going through the facility screening. They are not able to get the vaccine today, so they will have to rebook. So we want to go ahead and document this, that they aren't going to pass facility screening. So we click on the document and classify, and I'm going to scroll down and I'm going to mark them as not immunized, did not pass facility screening. Okay, now with this one, there's no point routing them because they're not going through the rest of the clinic. They're actually going to be leaving the clinic. So as I've mentioned, we use the close. Okay. So I go ahead and close that ticket. All right. And then we're going to go ahead and help Triton. Since we're here, we're going to go ahead and do that. So I can just click and call. Does the same thing as next in service. So I've called Triton. I've gone through the facility screening with him. He passes, so I'm going to route him to the screened and checked in. All right. So again, going to put on my immunizer hat and I'm going to start calling the people in the screened and checked in. Okay. So I'm going to again use the next in service. Okay. So I've got Austin here. I'm going through my screening. Austin doesn't pass the vaccination screening. Okay, so what we want to do is we will again go into your document and classify, go down to your classifications, and this time I'm going to pick not immunized, did not pass vaccine screening. And then again, we're not routing them because there's no point sending them to clear to go and check out. He doesn't have to wait 15 minutes because he wasn't immunized today. So we can go ahead and click on close. Okay. All right. Now, if you're wanting to review that information, this is when we can change our filter. So I'm going to change my filter now to the Served by Me, and I'm going to show you some quick tips on this. So with our Served by Me in the service console, green means that the case is completed. Okay, so when you see completed and it says like the pop-up does here, completed in a training clinic calendar. If you see them completed in the calendar, that means that they actually did not pass facility screening. Okay. Whereas if I go to the next one, to Shelby, it says completed in the clear to go and check out. That means they were routed all the way through to clear to go and check out, which means they were immunized. And if I look down in the clear to go and check out, there's Shelby right there. So typically, if you see them in the clear to go and check out, that will mean that they were immunized. If you have somebody like Austin Martin that was complete in the screened and checked in, that would mean that they were not immunized, either because they did not pass the vaccine screening or because they did not give consent. Okay, so you can find a lot of information within the service console. The other thing you can do to verify if you're not sure is on the far right-hand side here, you have the option to view the case. So you can bring that up and you can, as I said, go into the interactions history. And you can see, that's right, they were not immunized, did not pass vaccine screening. Okay. Now, if you accidentally closed one and you did not mean to, when you view it in there, so if I was looking, I'm not going to use this one as an example, I'm going to use one that was in my calendar. And let me see, I have Iago here. Iago was closed in the calendar. So maybe I accidentally closed him and I didn't mean to. So I can click on the view and I can revive that case. That would add him back into the calendar. Okay. I'm not, because I already documented that he didn't pass facility screening, but you can if you've done that in error. Okay, you do have the ability to reopen a case if you've closed it in error. Okay, I'm going to go ahead and close this tab. And I'm going to go ahead and change my filter back to the waiting and expected. Now we're going to look at the last thing that I'm going to show you today, which is the direct admits. Okay. So direct admits are used if the clinic is accepting walk-ins, or maybe if there's vaccine left over at the end of the day. The clinic may have a short call list or a list of employees that they can bring in to be vaccinated. These appointments cannot be booked on the booking site as there are actually no appointments left for the day. So this is where you will use the direct admit. So I click on the direct admit. Now, before I ever direct admit somebody, I probably would have done the facility screening with them first to make sure that I could even immunize them. I would probably have checked Panorama to make sure that they hadn't received a first dose. So there are some clinic procedures that should be in place before you ever direct admit anyone. But once you are ready, you click on the direct admit like I did. It starts a ticket for us. So now what we need to do is we need to find our patient information. So I'm going to go ahead and click on the plus sign to find a patient. Okay. Now they may or may not be in the system already. It's always a good idea to check first. So you have a number of ways of doing that. If you know what their personal ID was, you could just enter it in here and select it. You can find them, or you do have the ability to create a brand new record. Okay. So if I want to find a patient, okay, there we go. So I've got Ariel Princess in for a direct admit. Okay, so she is the one assigned to this case. As I said, I would have already done the COVID screening with her, or the facility screening. She passed. Now, if I wasn't quite ready to send her off to the immunization station, I could return her to queue. But in this case, I'm just going to go ahead and route her to the screened and checked in so that she could be immunized. So now, of course, there are many other scenarios that you could run across, and we cannot cover them all in training, but hopefully with what you've learned today, you can work through them. We do have a digital health support team led by Brenda Jackman that will have leads for each of the IHICs. If you have any questions or concerns or would like any additional support, please bring it forward with your leadership group so that that team can help resolve it as soon as possible. The clinics will also have the digital health support for the patient booking systems, phone number and email address. And again, it can be found on that training site that I showed you. We are also offering more training sessions. So if you feel you would benefit from an in-person training, feel free to sign up for one of those with your manager's approval. Thank you for attending our training today. Have a great rest of your day.